pleasure to be here this morning and to talk about one of my favorite topics of how my analyst team really, because it's digital transformation and artificial intelligence is really a topic that's spanning all of our research. Particularly as we get more and more data that's coming off of whether it's our consumer devices. I'm wearing my watch, so I'll be able to tell when it's my time to step down, so you can all go to lunch. Or whether it's through our electronic health records or any manner of healthcare systems that we have, we're throwing off lots and lots of data in such a velocity that really we can't keep up with it. If you look at the amount of data that is being generated by the research community and being able to mine that medical literature, we really need to have help with that. And that's an important role for machine learning and artificial intelligence and deep learning. And so my colleagues on my team, including the folks on the life science, I have a counterpart who is looking at artificial intelligence both on the research and development side as well as the the commercial side and how they're using these different techniques to understand what's going on in their business. So we, like I said, spent a lot of time talking on this topic. So across the teams, we really are looking at three key findings, for artificial intelligence. We really do believe, as my preamble stated, that with so much information being generated in healthcare today, that artificial intelligence is going to be integral to digital transformation. And as a result of that, we are beginning to see it gaining traction in healthcare. And I'll show you some examples as we go along in my presentation. One of the things that we do see, I think there's been some early projects that were perhaps not as successful. Certainly AI has been overhyped, particularly in the healthcare space. But we are seeing an emerging model of a hybrid deployment that's providing a great deal of flexibility, and I'll just walk you through what that model looks like. But I think that's really where we're going to see the early adoption of AI in this generation of AI take place. And then lastly, of course, there are barriers, to using this technology. But again, I'll provide some recommendations on how we can overcome that. Many of the barriers are not really technical or data, although there certainly are those issues to be concerned about, but are really cultural issues. And I think, when we look back on a lot of IT projects, a lot of times the biggest challenges we have is that change management. People inherently don't like change, even if that change is going to promise something good in the long term. People like to do how they worked before, and so I think that holds true for artificial intelligence. So as I stated, AI very much integral to digital transformation. We're doing a lot of work in the digital transformation space across IDC, not only just in the insights, the industry groups. But one of the things I think is worth mentioning is the fact that we're really beginning to see healthcare organizations recognize the importance of artificial intelligence and really seeing it as part of key to their transformation strategy. You can see the stats here that 24% of providers and 16% of payers report that this is now becoming integral to how they're transforming their businesses and becoming a digital-first organization. So with that, we've been, of course, with our research on digital transformation, have been defining a set of taxonomies. We have these taxonomies across 16 industries. What you're looking at here is the value-based health digital transformation taxonomy. My colleagues, Alan Louie and Mike Townsend, have also created a similar taxonomy for knowledge-based medicine. And as we go through this, we look at a mission first. And for us on the health side of the team, it's really that value-based health. How do we achieve the quadruple aim of reducing costs while improving quality of care, and then, of course, improving the experience of both patients and clinicians? That's where you get that quadruple aim. Originally, it was the triple aim, but it became very clear that we also needed to look at how our clinicians were experiencing all of these new technologies and changes and improving their experience as well. And so that's at the top level, and then we look at strategic priorities, what it is that we are trying to accomplish. Underneath that are then funded programs that really start to look more detailed and more granularly at achieving those accomplishments. So how do we actually achieve those strategic priorities? And then lastly, it's the use cases. And that's really where I think a lot of the interesting and important work, is happening, because it's very actionable areas of focus for organizations. And so I've identified here 11 use cases that have AI as part of their underlying technologies. And of course, as the maturity of AI models and other technologies evolve, and particularly as we look at the strategic priority of convenient access to care and being able to do remote health monitoring and telehealth and all these other sorts of services, we'll clearly see more AI being incorporated into these use cases. So, this is really, the sort of the first stage, if you will. Scott's talked about 3 different eras of using artificial intelligence, and as we start moving across those eras, of course, there'll be more use cases that will be very much reliant on artificial intelligence. And so it is gaining traction. I mean, you can see here by the spend statistics. 3 years ago, it was approximately $520 million. These are worldwide figures, by the way, and just for providers. It's now almost quadrupled, and so we're seeing a very, fairly decent CAGR here of 37%. Couple of things to note: worldwide, providers only, and also just looking at platforms. So we haven't actually gone out yet and measured, because then it's like, how do you peel apart that onion and be able to actually measure the AI that's in embedded applications? And so we're seeing a lot of growth of those types of applications. Those numbers are not reflected here. So if we were to, so keep in mind, if we were to include those numbers, we'd see significantly more growth in the use of AI with providers from a spend perspective. So where are the providers and the payers on this? We poll, survey. IDC conducts, hundreds of thousands of surveys, over the course of the year. This particular one, we were asking them about, where they were today in the deployment of cognitive systems or artificial intelligence. And you can see here from the data that payers are really reporting, a greater use of AI than the provider organization in this particular survey. And we think partly that's because size does matter. Payers tend to be slightly larger organizations, certainly, particularly the ones that we have in our sample size. It's an easy place to start on the administrative and financial types of operations for deploying AI. Nobody dies if a claim is processed incorrectly, whereas if an AI system makes a clinical recommendation, there could be consequences, that are very serious, could actually be life and death. And so I think we found that payer organizations were, more willing to step up and start using AI systems. And also in this survey, there's probably likely some small, mid to large size enterprises as opposed to academic medical institutions. And that's really where today we see a lot of the AI initiatives happening around, primarily the large academic medical centers. So why is there a difference between, besides size on this? And I think, again, I harken back to the fact that AI has been, overhyped as a panacea for a lot of things. Some of the early initiatives, certainly folks did get out over their skis, if you will, to use that metaphor. And there's also the cultural aspects. From a provider perspective, I think physicians were quite wary about losing their jobs, being replaced by the machine. Certainly that's a struggle too on the provider side. Nobody likes to think about machines taking over their, over their jobs. And there's also a difference in the data sets between payers and providers. Provider organizations have a much more complex, diverse, much more in the way of unstructured data than payer organizations have. And their processes are the payer processes are probably a lot more better defined in many ways. There's set ways to do claims processing, there's set ways to do other sorts of administrative processing. We're just now getting used, quite frankly, of using a lot of these electronic health systems and other sorts of things, on the provider side. And so consequently, because payers have invested earlier in core administrative technologies, they're a little bit of an advantage to start using these types of tools. And also they have real business driver needs, on the analytics side to leverage this. So one of the things, as my team has talked about AI and how it's going to fit into into use for both payers and providers is we've come up with a model that really talks about a hybrid approach. And at its core will be that curated data that's been cleansed, that's been harmonized, has all the tools. One of my colleagues refers to them as the Lego building blocks for artificial intelligence, and that really is the IoT. The cognitive platform, the AI platform, and around that, in order to really support that well, one will need to have the data scientists, but it really does start to provide you the most flexibility in using these sorts of tools. Next up, we have the embedded applications, and these are where we see much more easily consumed AI, because the AI is actually built in, if you will, but they're very purpose-built, very task-oriented. Sets of models and things like closing gaps of care or risk stratification, identifying patients who might have sepsis. If you went back and looked at that chart with the taxonomy, a lot of that AI was embedded AI for very specific use cases. And so we see technology vendors like Vitreous and Kensai offering tool sets to help their customers do very specific things with AI as part of their applications. And then here is where we see that hybrid model, where it's really a combination of both a platform as well as some of that embedded AI. So you can move very quickly as you start getting used to using AI by using the embedded applications. But then as your organizations become more facile with machine learning and creating data models and teaching the AI models, we can start actually getting to the point where it's data as a service. And so we see vendors like Health Catalyst and some of the EHR vendors really play that role where they're making and opening up their data sets so that folks can apply the AI models to that data and actually start using that for deeper machine learning than they could do before. So we do believe that this model is going to be one that really helps kind of democratize artificial intelligence, especially across a wider range of healthcare organizations, both large and small. So we do see 4 usage patterns that are really taking off in healthcare. One is that whole notion of predict. And so the predictive analytics is probably the lion's share of a lot of that embedded AI that I referred to before. And so being able to identify those patients that are most at risk so that we can clinically intervene before they succumb to sepsis, or we can clinically intervene before they're about to be readmitted into the hospital. I mean, can result in a significant savings. The ARC has come up with a study that says for every $1 spent, there's $10 spent for admissions. There's another $10 spent on readmission. So it's a significant savings if we can avoid those preventable readmissions. And then conversational AI, and I think this is one that will be interesting from a consumer perspective. I mean, we've all gotten very used to talking to our smartphones. Now, if the score of last night's game had been different, I would have suggested, what was the score of the game last night with the Pats? Fortunately, they lost. But we probably all used AI in order to find our way here to the seaport. And consumers are getting used to this. We spent a lot of money probably on Cyber Monday, and we chatted with chatbots, and some consumers might not even realize, because they've gotten so good, that there's not actually a human behind that picture that's on the on their the portal for the website for their whatever retailer they're interacting with. And so they'll become much more interested in having these sorts of conversations from a healthcare perspective. There's Florence, the app that you see here, helps with medication reminders, helps consumers track their weight, other sort of health goals. Conversa is actually a really very interesting company. They actually have 500 clinically intelligent conversations that they have as part of their platform. And so these conversations can help consumers or patients walk through things like pre-admission, post-discharge, managing their chronic conditions and things of that like. So really an opportunity to provide very high-touch experience, and yet using AI to make that smarter. Excuse me. Recognition is another use case that we're seeing get a lot of traction, particularly in the medical imaging space. And when you look at how fast that data is growing and how much, particularly as that technology advances, that being able to have, a radiologist's reading being augmented, through machine learning, through this pattern recognition will be very critical. AI is not going to replace radiologists, particularly in the near term when you think of some of the liability issues that folks are concerned about, and very rightly so. But certainly will play a major role in helping organizations, improve their throughput with radiology and make the radiologist more productive. And then lastly, process automation. This we see a lot more in the business setting. Claims processing is having a lot of, has made a lot of headway of using RPA as part of payers as part of the work that they're doing there. And again, being able to kind of increase throughput, increase productivity, increase efficiency, and then use the humans for more challenging questions, more challenging processing capabilities. And so kind of take the routine and sort of error-prone activities and let the machine do that, which they do really quite well. So this is the framework that you saw in Scott's presentation. I won't spend a lot of time here, but it is something that across IDC we are looking at, this automation framework and then how we are going to apply it to our various research areas. So if you look at what we did here with population health, we started to look at what were the tasks that could be automated with artificial intelligence. Then as we move up, what sorts of processes could we do, like schedule appointments or start down that path of patient risk stratification, and then really just moving up that stack. And so this will be a piece of research that we'll be publishing probably in the next quarter or two, and I think that you will see lots more of these examples come out, not only in my team as we take different types of processes or systems. Here we have population health, but I can imagine that we'll do this across the board, both on the life science and health side of things. So with all of that, we've got good forward progress. We're having the embedded systems are really helping us to gain more traction and more experience. I highlighted a few use cases where healthcare organizations are really leveraging AI in a successful way. Yet it still really feels like a high wire act. And I think a lot of that is healthcare is a unique marketplace in the sense that it is highly regulated, probably on par with our financial services. I think the difference, of course, is that life and death aspect of health. Folks don't tend to die on the financial services side of things, but there are real serious implications, as I said before. So there's a lot of regulatory compliance, a lot of approvals. We're still sorting out how these algorithms move through an FDA process, and so a lot of it's still being done more like medical devices than actual certification of software. There's a whole notion of the cultural resistance that I talked about, physicians' fear, other clinician types fearing being replaced. And then also the fact that historically we haven't had a lot of great, benefits of this. I mean, we've had benefits in bits and pieces, and they've been achieved by large academic medical centers, but not on a widespread basis. A lot of overhype that people have been quite concerned. And even some of the large academic medical centers, without naming names, have had their challenges with the deployment of AI platforms. And really what it comes down to is, how do we build trust? And so when we talk to our customers about AI and how they go about deploying it, we talk about first, because this whole trust factor and the whole cultural resistance is give people a voice. Let them understand what it is you're doing. Ask them about what their concerns are, because you don't want to be blindsided at the end. Also set realistic expectations. AI is not going to end up being a complete panacea here. Be mindful of local variation. So when you're talking with your vendors, and as they're particularly the ones delivering embedded models, that they define things the same way that you do. So you may have a set way of defining your diabetic population. Make sure that marries up so that your expectations are met. There will be, as a result of that, a lot of iteration and validation, and so you want to be sure that your vendors will be there for the long term as you walk through that process. There's also the need to marry clinical and technology together, especially on the clinical judgment side. You want to have particularly as you start going down the path of incorporating AI in your clinical processes, that there's clinical judgment that's part of that. Change management is going to be big here. This is a lot of new digital transformation in and of itself provides organizations new ways of doing things and being able to create new business model, new processes. That's a lot of change. Now we're going to introduce and layer onto that the use of a machine as part of our team and part of our colleagues. And so how do we help organizations, and how do we help our fellow colleagues understand what that change was going to look like? You may want to also avoid sacred cows, and I think this is why payers have been fairly successful with some of their AI initiatives compared with provider organizations, is it's really easy to talk about AI in a business context, in a claims processing or other type of administrative context. You might not want to start your AI project if you're a provider organization with one of your chief department heads on one of their pet research projects and say, okay, we're going to introduce AI here, unless of course it's something that they've initiated. But everyone can get around the fact that no-shows are a problem for the organization. It's really costing us a lot of money. That might be a good place to experiment, something that everyone can agree on that needs to be fixed, that doesn't have a lot of angst going on about it. It's a fairly set and defined problem. And so we often suggest to folks, start with a business problem that everyone agrees, is challenging, and avoid those sacred cows, at least to start, unless that sacred cow wants to be your next AI project. And really what it comes down to is all about building trust, and building trust through transparent algorithms. I think some of the early projects, because they were such black box initiatives, that it was very difficult for organizations to fully embrace, on a wider scale. And certainly Scott talked at length about, this whole notion of these transparent algorithms. No one wants to be, brought up, whether it's at the IRB board or, in a malpractice situation. How did the machine make this diagnosis? Why did we have this bad outcome? So very important that, there be transparency and trust. But we do think that there's a lot of opportunity for artificial intelligence in healthcare. We're really very excited about it. It's definitely a big area of focus for us, particularly as we meld and combine the whole notion of digital transformation along with artificial intelligence. So I thank you for your attention.